Today, we are diving into something truly fascinating. We're looking at the absolute cutting-edge future of public health. Now, the Nigeria Center for Disease Control and Prevention, the NCDC, has already proven its massive value, right? They've been on the front lines, coordinating outbreak responses, and acting as a critical force in protecting lives. But what we're looking at today isn't just about controlling diseases anymore. It's about a massive next step. It's about building a system so innovative and so bulletproof that it stands shoulder to shoulder with the absolute best in the world. Which brings us to a really provocative question. Can the NCDC evolve into a global leader in public health? We're talking comparable to institutions like the World Health Organization. Is it possible for a national center to actually become a blueprint for global safety? Well, the data points to a resounding yes. But it requires a bold, ground-up transformation, a complete paradigm shift in how we manage public health.
And that bold transformation? It comes down to exactly 10 distinct, highly innovative strategies. This number is the core of the comprehensive blueprint we are about to explore. 10 steps to take a highly effective national agency and supercharge it into a global health powerhouse. And it's so important to understand, we aren't just talking about a software upgrade here. It is a total rewiring of public health infrastructure, creating a model that even the WHO could learn from.
Okay, let's dive right into this. To make sense of it all, we can group these 10 points into 4 strategic phases: predicting threats before spreading, smart community and environmental action, building independent local capacity, and finally, becoming a global public health leader.
Kicking things off with Phase 1, Tech and Detection. This is all about predicting threats before they even have a chance to spread.
To shift from just being reactive, waiting for an outbreak to happen, to being radically proactive, we need an impenetrable detection net. And that's made up of 3 things: predictive intelligence, expanded genomic surveillance, and a unified national dashboard.
Now, what's really interesting about this is the sheer scale of the data involved. We aren't just looking at sick patients in clinic beds anymore. Predictive intelligence means using AI and big data to foresee outbreaks. By feeding hospital data, community reports, and even climate patterns into an AI, we can build a real-time early warning system. Imagine an AI spotting a subtle shift in climate patterns, combining it with local health pings, and boom, flagging a potential cholera outbreak weeks before it hits the headlines. It's like having a crystal ball for public health. But hey, when a pathogen does pop up, we need to know exactly what we are dealing with. That leads to point 2, expanded genomic surveillance. By setting up state-of-the-art sequencing labs all over the country, they'll be able to track disease mutations at warp speed. Catching a highly contagious variant before it ever crosses a state line, that makes the response incredibly fast and targeted.
And point 3 brings the whole shebang together: a unified health intelligence dashboard. Think of this as the ultimate command center. It's one single platform that pulls in the predictive AI data, the lab results, and the environmental alerts. By bringing all these massive data streams into one place, you completely transform how leaders make decisions. It takes all the guesswork out of crisis management.
But how do we make sure all this high-tech wizardry actually reaches the grassroots level? That brings us to Phase 2, Smart Community and Environmental Action.
This phase covers points 4, 5, and 7: digital community surveillance, smart environmental health, and smarter communication. Because true health innovation has to step way outside the walls of traditional hospitals. First up, we've got to conquer the map. Community surveillance has to go digital. By arming community health workers with mobile tools, we can capture real-time cases even in the most remote rural areas. Zero blind spots. No matter how remote a village is, its health data plugs right back into that unified dashboard we just talked about. Now, check out these smart environmental solutions. We're talking solar-powered waste systems, sanitation monitoring tech, advanced environmental sensors. These aren't just neat gadgets, they are literal defense mechanisms. They bypass power grid issues and stop diseases directly at the source, long before a human ever gets infected. This is next-generation stuff. So, the crucial point here is this: having world-class medical tech means absolutely nothing if the public doesn't trust it. Smarter communication tackles the modern plague of misinformation. By using real-time social listening and behavioral insights, we can connect with people exactly where they are. It's all about smart digital engagement, making sure the truth moves way faster than the rumors.
Moving on to Phase 3, Infrastructure and R&D, building independent local capacity. Look, for an agency to be a true global powerhouse, it can't just rely on outside help forever.
It requires moving aggressively towards self-reliance through local R&D, evolving the workforce, and faster emergency response.
Point 6 is an absolute game changer. Investing deeply in local research and development. By developing vaccines, diagnostics, and health tech right at home, we drastically cut down dependence on foreign supply chains. Local R&D is the ultimate key to true independence and resilience.
And this brilliantly illustrates how the people behind the scenes have to evolve too. The traditional public health system relied almost entirely on epidemiologists. But a modern tech-driven system, you need epidemiologists working side by side with data scientists, AI specialists, and innovation experts. A highly predictive health system absolutely needs a deeply diversified, tech-savvy team. All of this capacity directly fuels rapid action. It starts with fully equipped emergency operations centers in every single state. Combine those with advanced simulations and predictive models, and you get a lightning-fast, perfectly coordinated response the exact second an outbreak occurs.
Which brings us to the final piece of the puzzle. Phase 4, Global Impact. Stepping up as a global public health leader.
We're talking about a fundamental shift in identity here. The NCDC has always been a strong global participant, but the goal now? Moving well beyond national borders to step up as a definitive global leader. And that's the 10th and final point of the strategy. Leading the global conversation. By actively publishing groundbreaking research, spearheading regional collaborations across Africa, and openly sharing crucial data with the world, they stop just following the international playbook and actually start writing it, cementing a status where even institutions like the WHO can learn from their blueprint.
I absolutely have to share this quote from the source material because it really hits the nail on the head. This is not about competition. It is about capacity. It is about innovation. It is about impact. Elevating public health isn't some race against other nations. It's a shared mission to protect human life through far better systems.
At the end of the day, that is what this entire 10-point blueprint boils down to. A system that detects faster, responds smarter, and protects better. By combining AI, digital tools, local R&D, and global leadership, they are actively building that exact system.
The future of public health isn't something we just sit around and wait for. It's something we actively build. And with this strategy, we are looking at a true global force. So I leave you with this. How will this blueprint reshape our global safety? I'd absolutely love to hear your take. If you enjoyed this explainer, please like, subscribe, and drop your thoughts in the comments so we can keep this important conversation going. Thanks for hanging out with me, and I'll catch you next time.